So we have discussed up to the auscultatory method in the part 1. So we'll discuss from the advantages of auscultatory method. Okay, so welcome back to the KN Education YouTube channel. In this video we'll discuss the part 2 and we'll end up the BP, right? Okay, so advantages of the, so whatever the possible MCQs is there, so in this video I will end up the overall everything BP, whatever it comes it will be fulfilled. Okay, so I hope everyone will watch up to the last so that you can get all the possible content for the unmanned questions and also for the possible MCQs that you can solve for in future or in the lifetime. Okay, so let's get started. So here what are the advantages of the auscultatory method? We know that there are two methods, that is palpatory method and also the auscultatory method. Auscultation, how we can do auscultation by the stealth, isn't it? So it is a very accurate method. Which one? The auscultatory method. Okay, so which one is the best method? That is auscultatory method. So here you can measure the SBP also, you can hear the sound, you can hear the sound, where in the auscultation you can hear the sound of SBP, and also you can feel that, sorry, you cannot hear the sound of DBP, that you can felt by which sense? That is by hearing itself, not hearing. Okay, so however you can hear it wherever the palpatory you can't able to hear here, you only feel. Are you understanding? So you can only feel the pulsation. Clear? So there may be you can only look for the SBP in the which one? Palpatory method. In the palpatory method you can't able to see the, you can't able to feel the DBP, right? Yes. So which is not at all accurate method. Which is not accurate method? Palpatory method is not accurate. Which one is the most accurate? That is auscultatory method is the most accurate. So it is a standardized method by using the step that we have done in the skill lab, right? Okay, so coming to the limitations of the palpatory, and we will compare that to the auscultatory too, isn't it? Palpatory means this one you should look for. So it will measures only the SBP only, and accuracy is very less in the palpatory, and sound will be not heard, it will be only felt by feeling, isn't it? Yes. So for the auscultatory you can look for the SBP plus DBP and it is more accurate, and yes, the sound will be heard and sound will be felt, that that disappearance and reappearance of the sound. Clear? So you can see SBP only you can hear in the only you can feel in the palpatory. There is no diastolic value in the palpatory. That is a limitation. Limitation means the deficiency, you can say, or the that you can't able to look for. Okay, the less accurate, you can't able to look for the accuracy, and you can't able to do it for the diagnosis. Okay, if you want to look for the hypertension or hypotension, according to the American Health Association, like 130 above or 140 above, there are some stages: hypertension stage 1, hypertension stage 2, and hypertension crisis. Based on this palpatory method you can't able to diagnose it properly. Clear? Okay, because that is a silent killer, and that may be the life threatening situation too, by making the cardiac conditions to be worsened. Okay, next, as the age increases we know that BP also rises, isn't it? So BP will rises according to the age. Okay, yes. What we know that BP cuff. Okay, what are the different aspects of the BP cuff? Here the BP cuff size, we need to look for the BP cuff size. Incorrect cuff will gives you the false BP readings, that may be false high or that may be false low. So cuff size, here I am telling about only the width of the cuff. Okay, so adult person will have the 12 to 13 centimeter, whereas large adult, or you can say that is obese patient, will have 15 centimeter width of the cuff size. Okay, width of the cuff size. So pediatric or a children, that should be 8 centimeter. Infant should be 4 centimeter. Very importantly, infant means 28 days. I am sorry for this. Okay, 28 sorry, okay, it is not centimeter. 28 days, 28 days to 2 years. Okay, some in the infant you can say up to 1 year also. The most accurate if you want means that you can say up to 18 months, up to 18 months. Okay, up to 18 months we can call that as infant, right? So in the MCQs if they given, tell it as a, say it for 2 years, right? Okay, so neonate is a 2.5 centimeter width of the cuff, right? Yes, correct patient position. So sitting position you can give if the supine is contraindicated, or the comfortness of the patient. So supine sitting position can be given, or supine can be given, or standing also given. Whatever the aspect is, you should make the very important the level of the sphygmomanometer, that is level of the sphygmomanometer should be heart level, or you can say chest level. Clear? Okay, arm at heart level. Arm should also heart level, it should not be above the heart level. Which one? Arm. So arm should be heart level only, above the heart level. So above the heart level what happens? Falsely low bp falsely low bp will come. Okay, so there is a back supported must be there. So next, these feet should be flattened. Okay, if they are slept, if they are sleep. Clear? Okay, correct position, that one. Next, bp measurement in sitting position. Sit upright, arm should be supported. Okay, cuff at heart level. Follow the auscultatory steps, right? Yes. So next, bp in supine position. So patient should be lying flat, that you know, arm supported at the heart level, as I said. bp in standing position, very importantly, if they are sat, if they sat or if they slept, that time if you make sure if they want to sit, or if, sorry, from the sitting or from the supine position, if they want to stand, that time, so you are checking the first bp you are checking here, and second bp you are checking here. So when you check the first bp, that will be like, okay, so that will be you got more than 90 by 60 of hg. So we can say it normal itself. Okay, how much? That is 120 by 80 itself. But all of a sudden if they stood, that time or second time also you will get 120 by 80 of hg. But you can't consider that, based on this you can't consider the patient is not having orthostatic hypotension. Why? Because you done immediately after the standing. After the standing you immediately assess, that's why you said it is, there is no complication, or there is no there is no medical abnormality. You declare like that, but it's not, it's a wrong. Okay, it's a wrong method. Sir, how we can do then? So after, okay, after sleeping, or after making him stand from the supine position or from the sitting position, wait at least for 1 to 3 minutes. Later on you can assess the bp and compare that. This may be the normal, but here you will get less than 90 by 60. So this one will be set as ortho hypotension. I hope you understood this one. So in the standing position, 100% you will get what? 100% you will get the hypotension in abnormal patient. Okay, if the patient is having the disease condition, that time it may get hypotension. Sir, what about BP in standing position? For the normal, for them you will get less than like 110 by 70, or 100 by 90, 100 by 80, like this you can get. Okay, so this most accurate is mercury BP assessment, right? Yes. What are the common errors? So wrong cuff size if you took, that is also errors you can do, because the BP reading will variation. Okay, the actual BP reading you don't know by doing the errors. Wrong cuff size, infant cuff. Okay, infant cuff, that is 4 centimeter width. You took 2.5 centimeter width for the infant, means what happens? Falsely high BP will come. Okay, falsely high BP will come, because so this BP cuff if you are using to the infant means that will be tight. So tight BP cuff will give you high, falsely high BP, right? Yes. Arm unsupported, if your arm unsupported, if it is higher or lower, if it is higher, falsely low BP will come. Okay, if you are making it lower than the heart level, that time it will gives you falsely high BP. Okay, rapid deflation, you can't get readings correctly, so these points you need to write. Wrong cuff size. Okay, talking in between the procedure, arm is unsupported, rapid deflation, measuring over the cloths, these things over the cloths if you are measuring, that also will gives you wrong. Okay, next, effects of the improper cuff size. Small cuff will give you falsely high BP, as I said. Large cuff, like adult cuff you are using to the infant, that time it will give you falsely low BP because of too loose, isn't it? If it is small cuff, it is too tight, isn't it? Too tight. Okay, so cuff above the heart level, yeah, cuff above the heart level will decreases the false low BP you will get. Cuff BP below the cuff bladder, or you can say that is bladder, or you can say that is cuff. Okay, so if it is bladder or a cuff, it is below the heart level, that time falsely high BP will get. So wherever you are using that, you should use falsely high BP, falsely low BP if it is not appropriate. Okay, if it is improper, that time you should use falsely high BP or low BP, right? Okay, common BP site, we know that BP site, if they ask brachial artery, pulse site is will be called as pulse site radial artery. Okay, so why brachial artery is preferred? Because it is easy accessible, and at the heart level. Okay, it gives you accurate readings, right? Next, so sorry for that. Okay, white coat hypertension means that sometimes what happens, so due to the wait for a minute. Okay, white coat hypertension means when what happens when the doctor comes inside the ward, that time they are wearing the white coat, isn't it? So due to the white coat, you will feel the doctor will come and inject you. Okay, so injection, or they will do the operation, some anxiety feelings will be there, so that due to the anxiety your BP may elevate temporarily, that is called falsely high BP. That is also falsely high BP. So but you should not say falsely high BP, because that will vary to everyone. So temporary BP rising due to the anxiety of the clinical setting, or due to the doctors, or we can say healthcare workers. So that is nothing but white coat hypertension. I hope you understood this one. Hypertension, as I said, persistent BP more than 2 settings, or more in the more than two settings or more than two situations. Hypotension less than 90/60 mm of Hg. What are the causes of the increased hypertension? Stress. Okay, hypertension means increased BP. Okay, so here increased BP or hypertension. Hypertension, that means sorry, that increased hypertension or high BP, you can say. Stress, obesity, smoking, renal disease, endocrine, these things will make you increased in BP, right? Yes. What are the causes of decreased BP? Okay, shock, especially the hypovolemic shock. Okay, next dehydration. Okay, in the malnutrition patient also we can see this one, especially the protein energy malnutrition, right? So hemorrhage, where we'll see hemorrhage? In the hyper, what we can say that, okay, so that one, okay, in the menstrual cycle abnormality. What are the menstrual cycle abnormality? Menorrhagia, okay, menorrhagia, and another one is polymenorrhagia, like that it will comes. Okay, so cardiac failure, MI. Okay, and we can say heart failure. Okay, in that we can see the decreased BP. There may be arrhythmia. Okay, there may be arrhythmia means abnormal in the conduction of the heart rate, that is arrhythmia, right? Yes. So drugs like antihypertensive, enalpril, okay, enalpril, and these whatever the antihypertensive drugs will be there, na, that is that wants to decrease the hypertension, but side effect of the all I all antihypertensive drugs is hypotension, very importantly. Clear? Okay. Advantages of the digital BP: it is very easy and fastly you can assess, and there is no need of a training for the digital BP assessment. Once they wrapped the cuff, and that's it, you can use that digital BP itself will gives you the systolic blood pressure and diastolic blood pressure. Okay, no need of special training or skills. Okay, for the mercury it need more training. So digital BP is not that much accurate. Which one is most accurate? Mercury. Affected by movement also. Okay, indications of frequent, why we need to do the frequent monitoring? Okay, every time frequent monitoring, or we can say frequent needed means every the number of times we in more number of times we need to assess, that is frequent monitoring. Whatever the continuous monitoring by the vital vital monitoring. Okay, vital sign monitor will be there. You check this image also in the Google. Okay, very important. So what are the indications means why we need to give the frequent monitoring, why we need to assess frequent monitoring in the ICU patients, that may be cardiac, or that may be neonatal, or that may be pediatric. Okay, ICU we need to check. Shock, hypovolemic shock for them in very important, because we need to look for always less than 90, less than 60, less than 40 if it is coming. So we need to give importance more. Okay, for the monitoring. Hypertension, because we are giving the medicine also, we have to check, recheck again in between the treatment also. Hypertension, so hypertension we need to frequently monitor, because in order to make sure for release, in order to make sure whether the treatment is succeeded or not. Post surgery, most commonly they will get hypotension. For that purpose we need to check the check for what we need to check for the this one, BP, right? So contraindications, which one we should not assess? Suppose here arm, okay, this side is IV line inserted, that time you should not do the BP assessment this side, you should assess this side where the IV line is not there. Or AV fistula means the For the blood transfusion they will use the what, one arm. Okay, so this is one arm if it is there. So blood transfusion if they are doing that time, you should not assess from this side, you should assess from left side. Not only left side, if this, okay, suppose here they fixed the IV line, or here they fixed the BT tube, that time you can do the opposite arm rather than doing the same arm. Okay, next, mastectomy side means what? So the breast, so due to the total mastectomy, subtotal mastectomy, complete partial mastectomy. What is mastectomy? Removal of the breast cancer, removal in of the breast cancer by making partial or complete incision, partial or complete incision, that is nothing but mastectomy, right? So suppose if I say this side and this side, right? So here there is a arm. So if they done the removal of the breast and their tissues and surrounding tissues, if they removed this side, so you should not assess the BP this side. Okay, you should assess here. Clear? Okay, next, if I say, okay, if it is mastectomy done this side, that means procedure surgical incision if they done this side, and removal of the breast in the left side. So this is a right side. Left side if they done, that time you should not assess the BP here, you should assess the BP this side. Clear? Or the injury if it is happened that side, you should not assess the BP. Clear? Okay. And which is very importantly, which is the most accurate, accurately you can get the assessment where you can get, that is on both side. On both side you need to assess. This is a very important one to make sure whether the both side the cardiovascular status is normal or not. Thank you for listening the class. I hope everyone understood this BP2. So hereby I am ending the all aspects of the BP. From this video I make sure that no chance of missing any questions from the BP. Thank you for watching this video. Thank you.